As a nurse, it shocks me. And for me, it is unacceptable.
This was Olga Makulevicius, a resident at Montreal CHSLD Herron in Dorval, where she died during the first wave of the pandemic. She's one of 53 seniors whose cases were examined in a damning Quebec coroner's report into the long-term care deaths of seniors in the spring of 2020. She was among those the coroner says died because of the lack of basic care, likely due to dehydration, something volunteer nurse at Herron during that time, Loredana Mule, witnessed.
I wasn't expecting to find the sort of horrendous conditions that I discovered. I believe that they were sitting in urine and feces for about a day or so. And when I got into my car, I still had the stench of urine and feces up my nose, and I just broke down. I just couldn't believe it. I cried. They looked abandoned and lacking basic life care.
One Herron resident, Thomas Bohr, who had a tracheostomy that required regular suction and humidification, didn't receive the supervision and nursing care he needed, Coroner Jeanne Kamel wrote, which likely contributed to his death.
That patient should have been transferred to the hospital, especially with a tracheostomy. You know, his airway, breathing, circulation, everything is, at stake here. And, as for the center, for the director or whoever is in charge of that, these are decisions that need to be taken, and quickly.
The coroner highlighted years of failings of public policies.
The politicians can say whatever they want. The reality is they're saying it's heaven, and the reality is hell for these elderlies. The whole system has to be revamped from A to Z, because it is not working at all. And people are suffering.
Kamel made 23 recommendations for the provincial government, the health ministry, local health boards, and the Quebec College of Physicians, including implementing safer ratios of healthcare professionals to CHSLD residents.
They need to start implementing work instructions, training, standards of operating procedures, supervisors, team leaders to obtain that functionality.
On Wednesday, Quebec's minister responsible for seniors, Marguerite Blais, said the province will put the recommendations in place.
I have a letter from François Legault stating that he was going to implement and he's going to take care of the situation. And frankly, I haven't seen anything. My heart goes out to them and to all the family members. I will never forget what I experienced.
In Montreal, Alyssia Rubertucci, City News.